Imagining Care Anywhere is the start of a conversation with everyone at Kaiser Permanente. It's about technology enabling care wherever our members are, at the clinic, at home, out and about, or in the hospital. There's 3 principles that guide Imagining Care Anywhere to make sure that our members' needs are at the center. Everyday life is the new context of care. Integrated care teams are linked to members, not places. And personalized health experiences are enabled through technology. Imagine Care Anywhere inspires new ideas as we shape the future of healthcare delivery.
We are in VTAC. Okay, to make it the crash part, I need help. Let's get some,
Extraordinarily good teams of anesthesiologists, surgeons, and nurses, when confronted with an OR emergency, missed about 20% of critical steps.
So what's your brand at the end?
And so we were trying to look into digital solutions that would actually help the teams use the checklist more efficiently. We kind of came down to the 3 technical solutions along with the paper checklist and a no checklist solution and tested them all together. The benefits of testing all these concepts at once. You have lower cost to the organization. You are not buying expensive vendor technology. You are just creating an experience.
If you give the same teams checklists and give them access to those in a very scientifically randomized way, you find out that it cuts their miss rate for critical steps by about 75%.
When we look at a technology and we install it at Garfield Center, we look at the technology in a level of detail that's hard to do anywhere else.
So I'm going to be monitoring this strip right here.
We ran somewhere in the neighborhood of 2,500 different test cases on how an alarm can be generated, processed, and reacted to by a human being. And we made sure that 1, the technology was sound, but 2, that the workflow processes were optimal. And through that testing and through those design and engineering activities, we've uncovered deficiencies in products that vendors didn't know that they had. And we've been able to work with them, and they've been able to improve their products, and thereby improving healthcare industry across the globe.
There was always this question about, is this enough space? How does it really work? You know, how are the workflows really going to change?
1, 2, 3.
I don't think there is a replacement for actually physically being in the space and being able to touch and being able to simulate and just experience it. Having the high fidelity really helps them really feel like they're in their space. And then they can even go further with all of the simulations again.
Hi, Mama.
Now we have the private rooms. This is a benefit for our patients and also for the family, because we have family-centered care, and being a womb-like environment for the baby is really important.
Stop! In the name of germs, before you contaminate.
When our team was assigned in the C. diff prevention work, the hand hygiene and isolation, we thought, wow, they really gave us the most difficult task because improving people's hand hygiene has been very difficult. What the Garfield Center did for us, it provided us space. So we actually had 2 tracks to run people through.
Doctor, before you come in, is it okay if you put on a gown and gloves? Then the germs know that.
There were 6 stations throughout the day that they went through to really find out what did a standardized workflow look like.
Sir, please don't forget to wash your hands with soap and water.
How could they practice it, and how could they take it back to their frontline people that they work with? To have the opportunity to really work out what the workflows are and how do you do it properly has really benefited our patients, and our C. diff rates have decreased dramatically.
fire extinguisher, please.
Okay. What's the next step?
When you talk with someone not from Kaiser Permanente, we talk about the Garfield Center with envy,
Has the fire been extinguished?
about what they could accomplish if they had a facility that had those same capabilities.
Where's that water? Okay, here are you.
Having the word innovation in it makes people come with a different type of mindset.
It is the opportunity to imagine the future, but then start to put it into action without having to build a complete new hospital or cause some massive disruption.
We can really test our ideas, and if it fails, it's okay. And we can go back and redo it and reiterate and keep doing it until we get the right solution.
Can I get you a gown, doctor?
The fact that we invest in a place that we can try and test things before deploying them out into operations, I think gives us a huge leg up in doing things successfully across the program.